Functioning International presents this luncheon lecture. Today's topic, the nutritional approach to anxiety and depression. Your presenter, Chad Crear, ND, DC.
How's everybody doing? Freezing? So we're going to go through some of the more common nutrients that can be used for depression and anxiety. And what I've tried to do today is actually take the proper dosages. So not just tell you about the nutrients, but actually give you the dosages that would most likely be used if you were to see somebody who worked nutritionally with these types of illnesses. So we'll try to go through quite a bit of information today, and like she said, if you could hold your questions till the end, that would be good. Okay, depression. So depression is the most common emotional disturbance that a general practitioner would see. About one quarter of us at some time in our life, if we live in America, will have depression. So one person out of every 5 in this room would suffer from depression at some point in their lifetime. As far as mental illness goes, it'd be the leading cause of hospitalization. So if we're going to see somebody in the hospital for a mental illness, depression is most likely the culprit. The diagnosis, and a lot of you probably know all this, but we're just going to give you some ideas of what goes into depression. So when we look at depression overall, poor appetite, and you could lose weight, or on the flip side, you can't quit eating and you gain weight. So one of those, it's a comfort food for some. It brings a lot of positive emotions from the past, smells, aromas, different things of that sort. So either we're so bummed out we can't eat, or we're so bummed out that we really need to eat to feel better. Insomnia, either can't sleep or that's all you can do is sleep. Agitation in the muscles, you can't sit still, or you just feel flaccid and just want to lay around. Loss of interest in things that would normally bring you pleasure, don't want to go to movies, you used to like to go to movies, don't want to socialize with friends at parties, used to like to do those kinds of things. Loss of sexual interest, then we know you're in trouble. And fatigue, so no energy. Feelings of worthlessness, inappropriate guilt over things where you really shouldn't feel guilty about, can't concentrate. Thoughts of suicide or death, recurrent thoughts. It's worse if you have a plan. So if you have five of those symptoms, you don't need the whole gamut of those, but 5 of those symptoms that lasted for a month or longer, that could be a pretty good indication that you have some sort of depression. There's different types. If you want to categorize it, you can try to put this into categories, although most of the time people are going to fall into more than one of these categories. So reactive, that's, it's a normal situation. The death of a loved one, of course, that's going to cause some alteration in mood. That's just a normal experience. Financial troubles, marital problems, fights at work, all those different things. Those are reactive. So a situation has happened to us, and reactively our mood changes. Endogenous, these are where we're looking at more of chemical changes. There's not an event that we can think of. We haven't had anyone recently die. We've been getting along pretty decent with our spouses. There's just nothing we can put our finger on. So endogenous, this could be a chemical imbalance, could be a nutritional imbalance, neurotransmitter imbalance, little brain chemicals that aren't quite where they need to be. Could be a hormonal imbalance, estrogen, progesterone, thyroid, all these different things play a role with mood. Drug-induced, so just as an example, there's many drugs that can have an altering effect on our mind. You could think of caffeine, coffee, cigarettes, recreational drugs. All of those things can have an effect on our mind, but then sometimes we don't think about oral contraceptive pills, and as depression tends to be more common in women, oral contraceptives tend to deplete your B vitamins, especially B6 and folate. B6 is needed to make all of the neurotransmitters. So if you're low in B6, it's hard to make your brain chemicals. Folate's needed for methylation. So you need methylation to also help make all of your monoamines, which are brain chemicals. So again, just some things to think about. Again, the medications, there are different types of medications. Look at alcohol, oral contraceptive pills, smoking, coffee. Corticosteroids, long-term use, beta blockers, antihypertensive meds, these things that affect the heart that can make us feel sluggish and have an effect on our mood. Hormones, again, as with menopause, it's a time of change. After having a hysterectomy, you sometimes not quite feel all the same. After pregnancy or during pregnancy, our emotions can be all over the place. In males, we call it male menopause or andropause, where actually testosterone levels go down below where they need to, or DHEA drops below where it needs to. So all those hormones can make a big difference. Nutrient deficiencies, and that's going to be our sole topic today, is looking at the nutrients that can affect our mind. Again, diet, excess simple sugars, so an overabundance of sugars in the body. Too much blood sugar messes with our brain, can create some swelling, and can cause fuzzy thinking. Low blood sugar, on the flip side, causes fuzzy thinking and anxious feelings a lot of the time. So having blood sugar imbalances can be a big issue. And then the brain chemicals and imbalance in neurotransmitters. Well, if you go to your doctor, you think you're maybe depressed. A lot of the times what they're going to do is give you the Beck Depression Inventory, and it's just a paper that you would fill out. It's got some questions on there, basically 21 questions, and you go down and answer those questions, and you rate those questions 0 to 3 based on how you're feeling. And so basically your doctor can get a good idea of how depressed you are if you truthfully and accurately fill out that depression inventory. And it just has questions basically on mood, sadness, self-like, self-blame, loss of interest in activities, all these different questions, and then we can score those. And anything less than 15 means that you may have mild depression. If you hit in the middle range there, it may be moderate, and then a score greater than 30 is severe depression. So that's something you can talk to your doctor about. They do have those forms online as well. There's usually a fee associated with ordering those because they're copyrighted, but you can take that at home or ask your doctor about something like that. Okay, so we're going to try to get into the nitty-gritty and go from there. Okay, so what's the whole point of using nutrients? We're going to kind of come up with the rationale and then what the goal of using nutrients should be. So the whole rationale is that the brain is affected by its local environment. Just like we were today. How many of you got up, went outside, and said, I should probably put a coat on? We're affected by our environment. Now, if we got up today and it was 100 degrees and we went outside, we'd be taking clothes off. So we're affected by our environment. I don't know if you can tell, my voice is a little raspy. I had a cold last week, got over the cold, and then my neighbor's garage blew up. So trying to rush, thought it was going to catch our house on fire, getting the kids out, and then realized I didn't have a shirt or shoes on out in the middle of the street the night it had